Antimicrobial resistance, or AMR, has become one of the biggest threats to global health security and endangers human development. It is a result of continued overuse and misuse of antimicrobials. Antibiotics are used to treat infectious diseases, as well as in life-saving medical procedures such as surgery and chemotherapy, to reduce the risk of infection. But antimicrobials are losing their power. Since 2015, countries around the Western Pacific region have been working together to increase awareness on AMR. AMR affects us all. Recognizing this, the Western Pacific Regional Framework on Accelerating the Fight Against AMR was endorsed by member states in 2019 and led to the launch of the movement to fight AMR. The member states in the Western Pacific region have rallied the campaign on AMR to set up national movements across sectors to protect each other and future generations from the very real threat of AMR. Over 200,000 people from countries across the region have taken a pledge to create a community of committed individuals that are stewards for the future, helping to stop overuse and misuse of antimicrobials and to make this the healthiest and safest region. Through the AMR movement, countries are coming together in solidarity to fight AMR. Today, we are here to acknowledge, recognize, and to feel proud of the work of our countries in leading the fight against AMR. COVID-19 has shown countries, now more than ever, the need to stand together to stop antimicrobial resistance. Countries adopted the theme for this year's campaign, Stewards for the Future, One Region, One Movement to Fight Antimicrobial Resistance. Although we cannot come together for bigger campaigns this year due to the challenges of COVID-19, countries did not stop to raise awareness and build movements to fight AMR. The WHO offices in countries worked with governments, health professionals, and other partners to observe this year's Antimicrobial Awareness Week. In Australia, the National Centre for Antimicrobial Stewardship organized a series of webinars for health professionals on topics such as AMR data, AMR, and COVID-19 or stewardship in the community. In Brunei, the Ministry of Health developed a social media campaign and organized activities in health facilities to raise further awareness in the community. In China, the National Health and Family Planning Commission and Ministry of Agriculture and Rural Affairs, joined by professional associations and networks, strengthened their commitment to work across sectors through enhanced information sharing on the consumption of antimicrobials in both animals and humans. In Japan, several professional organizations organized Stewards for the Future campaigns within their networks, calling on health professionals to lead in the fight against AMR through rational use of antibiotics in their practice and giving the right advice to patients about AMR. The AMR Clinical Reference Center also developed a new set of cartoons on AMR to help broaden the AMR movement to younger audiences. In Lao PDR, Stewards for the Future went down to Savannakhet Province to raise awareness in the community on key preventive measures such as good hand hygiene, but also to encourage people to consult a doctor before taking antimicrobials. In Malaysia and Singapore, both private and public hospitals organized a series of activities to reach out to patients, the general public, as well as health professionals. In Mongolia and Cambodia, a series of virtual events as well as social media campaigns were organized with involvement of health professionals as well as the general public. Across the Pacific, health professionals led community outreach activities in and around the hospital. The World Antimicrobial Awareness Week was also being used as an opportunity to build further capacity in areas such as stewardship, like in Fiji and Nauru, or IPC, like in Vanuatu. In Tonga, a poetry contest was held, while in Solomon Islands, a local radio broadcast ensured that key behaviors were promoted across the 6 major islands. In Papua New Guinea, the National AMR Steering Committee hosted the second National AMR Forum, attended by health professionals, policymakers, and development partners. The Pharmaceutical Society of PNG and the National Department of Health held a virtual meeting centered on the role of health professionals and professional organizations in mobilizing for AMR awareness and action. In addition, targeted awareness and advocacy activities in hospitals and through the media helped to raise awareness in the community. In the Philippines, a virtual national AMR summit was held throughout the World Antimicrobial Awareness Week, attracting thousands of health professionals from across the country. Moreover, a large pharmacy chain has identified itself as a steward for the future and is using its network of pharmacies to promote key behaviors to stop overuse and misuse of antimicrobials. In Vietnam, the Vietnam Medical Association came forward as a steward for the future by mobilizing its members to raise awareness on AMR in the community and hospitals. The four ministries leading the implementation of the 2015 Aid Memoir on AMR also held a National Stewards for the Future campaign event attended by professionals from across sectors. Across the Western Pacific region, several regional organizations, associations, and networks also came forward as stewards for the future. The International Pharmaceutical Students Federation held a large social media campaign and produced a booklet on AMR for its member organizations. In a region's first, WHO, FAO, OIE, and UNEP joined hands to organize the first virtual Tripartite Plus World Antimicrobial Awareness Week celebration with a focus on promoting the One Health approach in countries to fight AMR. Within communities, workplaces, schools, and homes, the AMR movement is growing as a result of our Stewards for the Future adopting and promoting key behaviors, such as consulting health professionals before taking antimicrobials, hand washing, or vaccination to slow down the spread of drug-resistant bacteria. Increasingly, everyone is starting to play their part to fight AMR. The continuing commitment of our member states to fight AMR is captured in the Stewards for the Future pledge site. WHO worked with countries to collect stories of the actions that Stewards for the Future have been taking to fight AMR.